Welcome back in. It's time for Health Headlines. You know, when it comes to eating healthy, there always seems to be a healthy alternative for just about everything. But what about olive oil and the healthiest cooking sprays and oils to use? Nutrition expert Dr. Beth Kitchen joins us now to talk about that. Good to see you this morning.
It's good to see you too, Mike.
You know, the olives and the olive oil, we hear that a lot, that Mediterranean
Right.
diet that's supposedly so effective
Sure.
and popular. But maybe some people aren't sure exactly what olives to buy, what type of olive oil to keep around.
Sure. For many, many years, we've talked about how good olive oil is for you. And if you replace those saturated fats, the plant fats, the things like, shortening and things like that with olive oil, there might be a benefit to that. It can lower blood pressure, your blood fats. It can help improve blood sugar, diabetes, and even maybe fight some cancers. But for a long time, Mike, all of those studies were observational studies. And those are the kinds of studies that we can't really show a cause and effect from. Well, now a couple of things have been going on in the world of heart disease research. And that is, first of all, they are doing better randomized controlled trials. Those are the studies where you can show cause and effect with olive oil. And they're also looking into what exactly is olive oil doing. And that's where things get pretty exciting. What they're finding is that there's this one lipid that we don't talk about very much, or lipid carrier, I should say. We talk about LDLs all the time, that bad cholesterol that tends to stick to the sides of the artery and cause heart disease. Now, what they're finding is this other lipoprotein, the fat carriers in the body. It's called apolipoprotein B. And you're probably going to be seeing a lot more about this as research is showing that that is more predictive of heart disease than LDLs alone, the low density lipoproteins alone, because these ApoBs carry the LDLs into the arteries. They penetrate the arteries, and so they make it stickier. And what researchers are finding is that olive oil tends to carry these ApoB lipoproteins out of your arteries to keep you healthier. So it's kind of confusing a little bit maybe, but it's very interesting stuff. Right now, doctors are not measuring this ApoB. But I think they will start in the future, but it's not part of their lipid panel just yet.
By the way, I love the fact that you're wearing olive green for the segment. That was very timely of you. But real quickly, though, for people who are going grocery shopping, tell them what they should go look for, and also how to store it when they keep it at their house.
Sure. You want to buy extra virgin olive oil. That's the one that has most of these polyphenols that are supposedly giving us all these health benefits. And so you want to buy extra virgin olive oil. Don't expect to get the same benefits from olives. I like to eat olives, but they've been cured so that they are palatable to eat. And so they don't have all those polyphenols in them. Look for in containers that are dark tinted. The tin containers are good because light and heat coming into that bottle can destroy those polyphenols, and we don't want that to happen. And then secondly, use olive oil as much as you can. Think about places where you can replace animal fats with olive oil, such as when you're cooking your scrambled eggs. Instead of using butter, use olive oil. You'd be surprised at how good it tastes. I even make my popcorn in olive oil. Now, it has a lower smoke point, so you have to cook at a little bit lower temperatures. You're not going to be able to fry chicken in olive oil, so don't bother trying that. But try to use it in places where it tastes good and it works really well.
And also check that use by date, because it can get a little rancid if you're not careful with that. And
that's right. Check that use by date. They all have it on it. Get the longest out use by date as you can. And that will give you, again, it will make those polyphenols that we want to be getting they will be in higher amounts in the olive oil.
Dr. Beth Kitchen, we appreciate it. Thank you.
Thank you, Mike.
I'm hungry now. Let's go take a break.